Awesome. Well, we're right at 11:03, and I see we still have some folks popping in, but good morning to all of you, and thank you for taking the time to join us today. Welcome to our Florida Healthcare Landscape and 2023 Policy Platform Review. My name is Scott Darius, and I'm the Executive Director of Florida Voices for Health, and we're really thrilled to have you all join us. I know, as we all get really excited to celebrate the end of the year, it's natural, I think, if not unavoidable, to think about next year and what the future might bring. And, you don't have to think about it long before realizing that we're in a critical moment when it comes to a lot of different issues impacting the communities we all serve. Now, from housing to the environment and education, I think we're at a big moment to kind of decide what the future will look like and what needs have to be addressed for us as a state, as a larger community to get to a good place. Now, I mentioned all those areas where we see a lot of big decisions ahead of us. And I think that this is also true when it comes to healthcare, and especially in Florida. Now, as you'll learn today, there are a lot of places where we can and need to improve. But today's presentation is really meant to lay out some of those priority issues impacting the most vulnerable, but we'll also highlight some of the major opportunities that our leaders have to make a lasting change and a difference in the lives of many. So this presentation will be the first of several chances to learn about the work that we're doing at Florida Voices for Health. We hope that as we go through the presentation, you'll also start to consider, opportunities for collaboration and really start to consider us as a resource. Now, just a few, logistical notes before we get started here. We'll take some questions at the end of the presentation. Just feel free to put any questions you have in the chat or use the question and answer function, and we'll circle back to those at the end. Today's meeting is being recorded, and we'll share the slides and recording out with everyone in a follow-up email. Now, for those of you who might be new to Florida Voices for Health, we're a 501c3 nonpartisan health advocacy organization. Our goal is really to bring the voices and the stories of Floridians into the lawmaking process and hopefully create a system that's accessible and works for all Floridians. Now, we do this work primarily by working in coalition with a lot of great coalition partners, some of which I see on the call today. But we've, as an organization, typically focused on Medicaid issues, improving access to oral health, increasing consumer protections, and increasing access to care for Floridians with disabilities. Now, during a little bit of time that we'll spend together today, we'll briefly cover the values that we share as an organization that really guided our choices for policies to support. And then we'll dive right into the policy priorities before sharing a few quick ways you can get involved with Florida Voices. But before we get into the meat of today, the specifics, like I shared, Florida Voices, we exist really to empower those Floridians who are directly impacted by the gaps in our healthcare system. It's our relationships to those storytellers that really inform what we do and keep us grounded as we work to advocate on their behalf. Now, to remind us all of why this work and the policies that we'll discuss matter, we're honored to be joined by Jennifer Worden, who is one of the great people that we've had the honor to work with. I just wanted to give her the floor for a few minutes to kind of help put the work and the things that we'll talk about in a little bit of perspective. So Jennifer, the floor is yours.
Thank you. Good morning, everybody. I am lucky enough to be a mom to 4 amazing kiddos. And my son, Jay, is currently 8. And when Jay was 15 days old, he was ready to be released from the hospital. Unfortunately, his biological mom was not able to take him home. So my husband and I became non-relative caregivers to Jay. We took him home straight from the hospital. And his journey was where he was not able to be reunited with his birth family. And our family adopted Jay right before his first birthday. We sought the advice of our longtime trusted family physician and asked, what are we up against? Kind of give us some information. And what he told us was that despite the fact that Jay had been exposed to alcohol, tobacco, and methamphetamine prenatally, developmentally, he should be okay. And so we were okay, great. If there were going to be any struggles, the provider told us that we may see some ADHD type symptoms when he starts kindergarten, but what family isn't dealing with ADHD, right? Not a big deal. Around the time that Jay was 3, we started noticing some really big behaviors. At that time, I was also transitioning to be a stay-at-home mom. So I had a toddler and an infant, and I was no longer working. So it was a big transition for all of us. And I thought maybe it was me having a difficult time adjusting to this new situation for our family. But what we kind of started noticing was that these behaviors for him and these symptoms were starting to really present themselves outside of just our home. When he was in kindergarten and pre-K, in the school environment, these struggles continued. He would have a hard time regulating himself. He had a hard time with expressing his emotions. He had a hard time with memory. So there were just some different things that we were noticing that were challenges for him. And it was a really difficult journey to be on, because I was the mom that was asking for help. I was like, okay, please just help me remember, like, he has had this happen in the past. How might that be impacting what we're looking at? And it took us a little bit, but we ended up being pointed in the direction of the Florida Center for Early Childhood, where Jay was diagnosed at 5 years old as having fetal alcohol syndrome. Looking at Jay, you would see him as any other kiddo. He doesn't look like he has a disability. He is smart, he is funny. And to those of us who know him, we know just how wonderful he is. However, his brain-based challenges and his brain-based disability is often not well understood by the medical providers that we have to utilize. It's not understood very well by the mental health providers. And really, his disability impacts our entire family. What often ends up happening is that because this is an invisible disability, a lot of our families don't end up being able to receive services, or we get services that are misdiagnosed. And that can often lead to challenges with long-term situations, because if we're not meeting the needs of the root of behaviors, or the root of his challenges, things continue to spiral. I am happy to report that we've been able to start working on that support network, and we are getting to make some progress, but there is still a significant need for individuals, professionals, medical folks, lots of other individuals and areas to be able to understand the needs of individuals with FASD and fetal alcohol spectrum disorder.
Yeah, and thank you so much for sharing that. I think it just reminds us, right, like how close all of us are, right? Maybe unanticipated. Life feels really good one day, and it's just something changes, and we're all really on the edge of needing serious medical care or support. And I think, yeah, for those of us who maybe are on that edge right now, it just opens up that idea, right, of how close we all are. And so the things that we do to support our friends and family and neighbors, the policies we work to pass, how quickly any one of us might need those resources down the road. So I really appreciate you taking the time to share your story, but also to thank all the other Floridians who have taken their time to share their stories with us as Florida Voices. Now, I think sorry about that. So first, as we've long recognized, right, that some of our communities face unique barriers that ultimately make access to care uneven across the state. Even in the same communities, there are folks who don't have the same opportunities to get comprehensive care. We focus on policies as Florida Voices that move us forward toward creating equal opportunity for all Floridians to be healthy and productive. As an organization, we also believe that these policies should be fiscally responsible. And that means that these policies either save the state money, or the moderate amount of investment that it requires up front generates long-term benefit. Finally, we're really keen on policies that benefit all Floridians, whether that be directly or indirectly. Now, it's this value framework that helped us to land here, our priorities. We've classified the different policies that we'll discuss today under 2 general categories. The first being increasing access to care and health equity, and the second being protecting the rights of Florida's healthcare consumers. We'll walk through policy solutions that touch on Medicaid coverage, especially when it comes to oral health and Floridians with disabilities. We'll look at prescription drug costs and a short list of consumer protections for health insurance policyholders. Now, we'll start by looking at the healthcare landscape for low-income Floridians and the major opportunity that state legislators have to make an impact. Right now, we're coming out of the other side of the pandemic in terms of, I think, our ability to capture good data about who's uninsured in Florida. But still, in the most recent numbers available, we saw that almost 13% of Floridians were uninsured, and that's still good for fourth worst in the nation. We've also seen a surge in Medicaid enrollment due in large part to the declared public health emergency. And now we have 5.1 million Floridians who are enrolled when we were, at 4 million before the pandemic. I think it's a quite remarkable stat, mostly considering how, relatively restrictive our Medicaid program is. I think the amount of people we've seen become eligible for Medicaid in the last 2 years or so speaks to just how many Floridians are kind of living on the edge of deep poverty, especially right before the pandemic hit. Now, unfortunately, there are some communities that we see that are disproportionately impacted by the high cost of health insurance. This is especially true in rural Florida, where the uninsured rate is 13% higher than in urban parts of the state. Now, it's also true when you look at communities of color, who make up 50% of the thousands of Floridians who are left with no options for healthcare whatsoever. And yes, there are nearly 500,000 Floridians who don't have any options for care. These are people who earn below the poverty level and don't qualify for tax credits in the Affordable Care Act marketplace or for Medicaid coverage, which is the program we have for the working poor. It's this group of people we call the coverage gap. Now, the people in the coverage gap are made up of parents and caregivers and single adults. First of all, in Medicaid, in Florida, you have to be a parent of a dependent child to qualify for Medicaid at all. If you're a single childless adult, you don't qualify for help regardless of how little you make. Now, if you are a parent, to be eligible for Medicaid, you can't earn more than 31% of the federal poverty level. So for a family of 3, that means that a parent can't earn more than about $7,000 for the year and still qualify for healthcare. Now, it's for those working parents, particularly those who are working in the fields that are the backbone of Florida's economy, who earn maybe between $10,000 and $30,000 for the year. It's those people who often find themselves squarely in this coverage gap. But for the last 10 years, Florida's had the opportunity to change this. When the Affordable Care Act passed, it required states to expand their Medicaid programs to cover more low-income folks. But in 2012, the Supreme Court ruled that the ACA was constitutional, but that Medicaid expansion was optional for the states. Now, over the last 10 years, we've seen 38 other states kind of take up this opportunity, and Florida remains among one of the last holdouts, but it's not too late. There are a couple of reasons, though, why the experiences of other states is important, right? Now, it's been discouraging for Floridians who are living in this gap to have gone for so long while this option has existed. But I think it's also given us as a state the opportunity to watch how it's played out in other places and can really inform us as we have this choice in front of us now. Now, first, we've seen so far that no state has backed out of Medicaid expansion, although the ACA allows them to, especially if the federal government doesn't hold up their end of the bargain. I think it's telling that no state has backed out, and that includes a lot of our conservative states. Now, second, we've been able to watch this experiment play out and really get a good sense of what it'll mean for us economically. I think one of the biggest takeaways watching Medicaid expansion play out in other states is that we can say pretty definitively that we will save money if we expand. Now, according to our partners over at the Florida Policy Institute, we stand to save over $200 million a year just from eliminating some of the patchwork healthcare programs we have and reducing the amount of high care costs that we deliver in emergency rooms by investing in prevention instead. Now, the savings that we see are also fueled by the fact that the federal government would up its match dollars for Medicaid to 90%. The current split is 60-40 between the federal government and the state when it comes to Medicaid costs, but under expansion, the federal government would be responsible for 90% and Florida 10%. So Medicaid expansion, bottom line, would bring billions of dollars into the state from increased economic activity, but also other federal incentives like the additional $3 billion we stand to receive from the American Rescue Plan if we expand it. So bottom line is, it really is a great fiscal opportunity for the state to also provide coverage to more of our neighbors. Now, again, as Florida Voices have spent a lot of time hearing the stories of those hardworking, low-income Floridians, one issue that comes up with incredible consistency is the need for better access to oral health. As we know, oral health, it's just one of those places where Florida still has a long way to go. There are over 6 million people living in our state, specifically in areas that are considered to be dental provider shortage areas. And actually, this is a number that's grown over the last few years. And the status quo ultimately cost us as a state unnecessarily. In 2019, we spent more than $630 million on preventable emergency room visits related to oral health. Now, while children in low-income households generally get comprehensive coverage to oral health, and we still know that 1 in 5 kids in Florida suffers from treatable dental problems. But at Florida Voices, we continue to hear how hard it is for those working adults to also get dental care, even when they have Medicaid. Currently in Florida, people 21 and older who are enrolled in Medicaid only receive emergency dental services to alleviate pain, to take care of infections or both, really just the basics. Recognizing how important oral health is to our overall health, and in many ways, our ability to be a productive part of the workforce, we're proposing that Florida Medicaid offer a comprehensive dental coverage, a comprehensive dental plan for adults. Now, a comprehensive benefit would cover all the things that Medicaid currently doesn't, including routine diagnostic care, basic dental services like cleanings and x-rays, and major dental services like root canals and dentures. According to the American Dental Association Health Policy Institute, in a report that we commissioned last year, the net cost of adding this benefit in Florida is $29 million or $1.65 per enrollee per month, especially after reaching what we call the steady state in year 3 of implementation. Now, the researchers who put together this report for us considered that 3rd year as the year where our costs become predictable, because generally, it takes time to introduce the new benefit, to make people aware of it, and for providers to kind of adjust for its full impact. Now, we see what it could potentially mean for the state. Even though there's a bit of this cost up front, there's not just a drastic reduction in the use of emergency rooms and a healthier workforce, but there's an additional economic activity benefit that comes from it to the tune of $232 million a year. Now, as we move forward to consider policies aimed at Floridians with disabilities, I want to hand it over to my colleague, our advocacy director, Acadia Jacob.
Hi, good morning, everyone. Thanks so much, Scott, for handing it over. Just to get started here. Oh, there we are. So as this slide illustrates, as a society, we really don't do nearly enough to ensure that members of our community with disabilities can live up to their full potential. Florida has a slightly higher rate of individuals with disabilities than the rest of the country. As our population continues to grow and to age, that's just expected to continue increasing. In terms of the existing safety net that we have for individuals with disabilities, we've found it's overburdened and not functioning to serve those it was created to. The Florida I-Budget waiver, which pays for home-based community services that allow folks with disabilities to live in community outside institutions, has a backlog nearly as long as the total number that it's currently serving. Even more shocking than that, the total number of individuals with disabilities waiting for access to care. Their average wait time to receive assistance through the iBudget waiver program is 7 years. Oftentimes, it's much longer to receive assistance. The wait list and the other issues facing individuals with disabilities persist in large part because this is just not an area that the state of Florida is funding with priority. We rank 49th per capita in spending on services for disabilities in the nation. So given our understanding that the iBudget waiver was designed to ensure critical community-based care services, there are a variety of policy solutions available to help ensure that this program is able to function as it was intended for those it was created to serve. Most urgently, the iBudget waitlist can be eliminated. An additional appropriation of $1.2 billion, which, because Medicaid is a matching program, Florida would only be responsible for 40% of that amount, total amount of $480 million. This could move a total of 22,000 eligible individuals from that waitlist into services immediately. And to ensure the long-term sustainability of this program and prevent a waitlist backlog from recurring, future budget decisions could be made with the Agency for Persons with Disabilities in participation in those decision-making spaces. The APD has historically been excluded from these discussions year after year. We're seeing budget allocations that have left the agency under-resourced to meet the active levels of need that we're seeing. So including the APD is a critical step to breaking this cycle. Additionally, Floridians, with disabilities who are able to work may find employers don't offer insurance or that the private plans offered by their employers are insufficient or unable to meet the care needs of the worker. So on top of these concerns, as you saw in the first section, we as a state have some of the most restrictive income eligibility requirements around Medicaid in our nation. And these two factors often mean that Floridians with disabilities find themselves having to choose between working and earning or being eligible for the suite of full healthcare benefits the Medicaid program may be able to offer them. So 2 decades ago, federal laws were amended to help protect individuals with disabilities who are employed or seeking employment. And Florida Voices for Health recommends Florida legislators consider doing the same in our state. By authorizing what's called the Medicaid buy-in, Florida would ensure that disabled workers have increased opportunities to access health insurance, either as a primary insurance carrier or as supplemental insurance to ensure that their specialized needs that the private employer isn't able to offer them can be met. And additionally, we encourage legislators to consider expanding the term developmental disability to include fetal alcohol spectrum disorders. This is a leading cause of intellectual disability and birth defects, and legislative recognition would help increase diagnosis rates and promote opportunities for early intervention. So recognition could also increase access for those diagnosed with fetal alcohol spectrum disorders to critically needed community-based and home care services. Now I want to introduce our program director at Florida Voices for Health, Louisa McQueenie, to present on the rights of Florida health consumers.
Good morning, everyone. And thank you so much for joining us today for this important briefing on what the Florida's landscape looks like. Florida Voices for Health has been part of the Florida Health Insurance Advisory Board. I seem to have trouble moving my screen. So anyway, Florida Voices for Health, they've been part of the Florida Health Insurance Advisory Board for about 6-7 years now, and part of what that means is that we do recommendations for consumer protections or whatever we see whatever things we see in the individual and sponsored markets that are not covered by Medicaid or by Medicare. And we had our meeting in November, and we had 8 recommendations, and I'm very honored to say that all 8 of them went through unanimously, and I would like to go through some of them with you today. Next slide, please. Okay. Prescription drug costs in Florida. Well, fundamentally, we know that affordability is always an issue among the insured and the uninsured, especially when it comes to prescription drugs. In another survey, the Alteram Healthcare Value Hub looked at how Floridians are experiencing the cost of healthcare, including prescription drugs. And the Robert Wood Johnson Foundation found that 54% of Floridians were worried or very worried about affording the cost of prescription drugs in the future. One of the ways we can ameliorate some of these concerns is to put a cap on the cost of insulin at $35 a month. In 2023, the cost of insulin for people on Medicare will be no more than $35 per month, which includes insulin pumps. However, the new law does not extend to individual and group health plans. The cost of insulin, which has been around for 100 years, is 10 times higher in the United States than any other developed country and creates an enormous financial burden on Floridians who cannot survive without. We've all heard the heartbreaking stories. While there is no high cost of development to insulin and innovation is limited, there is also no free market where market forces would drive down the cost to consumers. This lack of free market allows for price increases at will for this life-saving medicine. Putting a cap on the price of insulin, will save money through less hospital admissions for high blood sugar emergencies and less health complications resulting in disability. Putting a cap on the cost of insulin to $35 a month would drive down the cost of healthcare for all Floridians and has real potential to help a lot of people in the state of Florida. Another big issue that's been popping up in the last 5-6 years, because it's become like a new policy addition that most people don't know about, is that deductibles that you might have started on one insurance plan, and then you have to change plans through no fault of your own because you changed jobs or you changed geographic area, or your employer changed certain plans, that the deductible starts all over again. And with the continual rise in annual health insurance deductibles to consumers, which could be up to $9,100 for an individual, up to $18,200 for a family in 2023, starting a deductible in the middle of the year could be really a financial hardship. Some policies require the insured to pay the entire deductible before they pay anything at all. And this is even more egregious when a consumer who is, again, not changing plans to no fault of their own, if they say go from Florida Blue to Florida Blue with the expectation that the deductible that they've already paid to Florida Blue Plan 1 that they were in, that it would transfer over to Florida Blue Plan 2 that they're now in, but it doesn't. And this is a real financial hardship. And what we recommended, and which was adopted, is to credit the amount paid towards the previous plan's deductible to the new plan. Another issue that's been popping up the last few years is something called the copay accumulator issue in policies. Copay accumulator makes one think, I have a copay and I'm accumulating the copay and it should go towards whatever I need to pay myself. However, it works the other way around. Some drug manufacturers and other third parties might help patients pay for their prescriptions because their medication is so expensive. For instance, hemophiliacs come to mind. They only have one drug that they can really take, and it's really expensive, and they get help. But the financial assistance that patients receive usually is a specified amount per year based on the cost of the prescription. And often they discover mid-year that the copay assistance limit has been reached and they have to pay the entire cost of the prescription drug because none of the third-party payments count towards their deductible or out-of-pocket costs. And it totally defeats the purpose of the copay assistance, meaning you're going to help the patient pay for the medication that they cannot afford otherwise. Research has shown that many patients will abandon their medication at the pharmacy or ration doses when they have to pay more than $75 up to $225 out of pocket, therefore foregoing life-saving medication. With the copay accumulator programs, insurance and PBMs, pharmacy benefit managers, are collecting the financial assistance intended for the patients and then require the patient to pay the deductible again, making it again harder for consumers to get their medications and other health care. So part of our policy option is that these payments made by third parties should count toward the deductible or total out-of-pocket costs for the patient. And basically the policy should be we should ban this whole practice altogether, and 14 states already have done so. But if we don't ban it altogether, at least make it very clear to the policy holders or potential policy holders that this is part of the policy. It is really difficult to find out in the policy that there is what is called a copay accumulator in that policy. It is not clear language. They don't all use the same language. And the only way you're going to find out if this really happens to you, and then you know what it means. And earlier this summer, Governor DeSantis issued an executive order, number 22-164, directing the state to implement healthcare reforms that reduce costs to consumers and promote transparency and hold the PBMs accountable. Adopting copay accumulator legislation that prohibits this practice would be the best, and it would align with the governor's commitments. 14 states have passed this legislation prohibiting these policies, among them Arkansas, Arizona, Connecticut, Georgia, Illinois, Kentucky, Louisiana, Maine, North Carolina, Oklahoma, Tennessee, Virginia, Washington, and West Virginia. Again, if we don't ban it altogether, then at least write some legislation where it has to be very clear to the policyholders that this is part of the policy. Another thing that we've been trying to make changes in legislation for many years is to provide health consumers with one free copy of their own medical records. It's become clear over the years that when people run into any problems with the health insurance companies, to get their own medical records is usually time-consuming and can get very expensive. They are entitled to a copy of their own records, but there is a fee, or a fee could be levied to do so. And I've seen many cases now where some of these records can contain thousands of pages and they can charge per page, and it becomes really, really very expensive. And also time, it takes so much time to do it all together. So our recommendation is that the free copy of your medical record should be provided by mail or email at the time of the request for payment for services. Having a patient see and review their medical records and related provided charges billed to the insurance would also bring down improper billing and potential fraud. This in turn should lead to lower health insurance costs to both the plan sponsors and to the individuals, and also to the state as a whole. Another problem that we've seen over the years is that insurance companies will move prescription drugs from one tier to another, or sometimes altogether, take them out of the formulary mid-year. Drug pricing remains, again, as we've said before, at the forefront of the consumer complaints when accessing health coverage. They often pick an insurance plan based on the prescription drugs covered and the cost tiers they're classified in. Consumers enter into a contract with the health insurance plan for a 12-month period and pay an agreed upon amount per month for this period based on the contract they were presented at the beginning of the period. Health insurance plans negotiate the drug prices with the pharmaceutical companies on behalf of consumers without any involvement of or say of the consumers. Insurance carriers then present the health plans, including the drug formularies and premium rates, to the Office of Insurance Regulation for approval. Again, the consumer has no input in this process whatsoever. However, the consumer is expected to pick up the extra cost in the end for any tier changes or go without the prescription they contracted for. This has been a policy recommendation for years now, and it's been again adopted unanimously. So hopefully this legislative session, we can make some changes there. Balance billing for ground emergency medical transportation. Governor Scott signed HB 221 into law, I believe it was 2019 or maybe 2017 maybe, which prohibited balance billing, which has been a great thing in the state of Florida. However, ground emergency medical transportation has been and still is excluded. It was still excluded in the No Surprises Act of 2019, signed into law by President Trump. It was still excluded there. Again, most people think they're covered for ground emergency medical transportation, only to find out that they might end up with a really big bill. And again, it should be added to the consumer protections. And then finally, but not least, applied behavioral analysis is part of Medicaid. It covers the medically necessary analysis to correct or ameliorate or defect a condition, physical, mental, or mental illness for eligible recipients under the age of 21. So what happens is once they reach the age of 22 and they are off of Medicaid, they cannot find a plan in the private health insurance market or most employer-sponsored plans that cover the same services that Medicaid has. Again, the board unanimously went ahead and said we want to require each carrier authorized to sell health insurance in the state of Florida to include a minimum one plan in each service area to cover these applied analysis services as covered by Medicaid. This is really, really important for young people with mental health issues that have been getting the services they needed, and then when they reach a certain age, the services go away. Again, I was very proud that all these recommendations went through. A letter will be sent to both the Speaker of the House, the President of the Senate, and to the Governor's office, reiterating that we've made these recommendations unanimously. And with that, I will give it back to Scott Darius.
Thank you so much, Louisa, and to Acadia and to Jennifer, really helping to round us out today as we shared a lot of information. Now, I understand that the chat function is disabled, so sorry if you haven't been able to use that, but if you do have questions or just want to offer a comment or thought, you can use the question and answer function and we can get to them in there. Before we circle back to see if there are any questions that folks might have, I just want to mention that us as Florida Voices, we're here as a resource to our community partners, to legislators, really to offer and try to connect you to some of those individuals who are impacted, who have their own stories to share, and also just a lot of the information and data and reporting that we've collected over the last few years. So please feel free to stay engaged with us, especially through legislative session. We send out regular email updates. We also host a monthly call where we debrief on some of what's happened in Tallahassee. We have a legislative session tracker where you can see bills as they're filed and kind of watch them as they move through the process. So yeah, we just encourage you to, if you want to reach out, you can email us here. or email me directly, as you'll see in a slide or two. But we really appreciate you all taking the time. So we'll give a second or so to see if there are any additional questions. And in the meantime, my email and our website are listed here. Mariana asks, are there some partners that we work with for oral health access? And that's a great question. There are a lot of great partners around the state. We've recently begun helping to lead the Florida Oral Health Alliance. And that's a coalition made up of community organizations and providers from across the state. If you do want to be a part of that, I'd encourage you to visit us at healthyfla.org/FOHA, just to learn a little bit more about the Alliance. But we also have some great partners over at Floridians for Dental Access. We do work a little bit with the Dental Hygienists Association and the Florida Dental Association. So there are a lot of great partners around the state, I think, doing work on this front. And our goal is to try to bring as many folks together as possible on that. Sandy asked a question about the constitutional amendment on Medicaid expansion. And yeah, that's another path we have to getting to what we think is a great solution for providing care for low-income Floridians. Florida Decides Healthcare is the PAC working on that issue. And I'd encourage you to check out the website, where we have a lot of information and resources about what's up next for the work there. I see Sunshine Burstkirk. Thank you so much for taking the time to join us today to participate. For anyone else, please feel free to reach out to us. If, I imagine we all have things that we're passionate about and things that we're working on. Know that Florida Voices is here as a resource. Even if we didn't touch on a specific policy today that you might be focused on, if you think that there's potential for partnership and intersection, please feel free to reach out, and we'll, just like work together to figure out how we can support you and your work. I'll give it another second or so to see if there are any more thoughts or questions in the chat, but just really appreciate, again, you all taking the time to join us. I know the holidays are right around the corner, and, we're all in a rush to like close down the last few things we have, but thank you so much for joining us today, everyone. I really appreciate it. Awesome. Have a great day, everyone. Thank you.